19th most common mistake is not using correct preposition with time and date. So when we are writing OET letter, we need to use time, we need to use date, weeks, month, year, everything. So we need to use the correct preposition. For time, the correct preposition is at. The patient is scheduled to arrive at 3 p.m. Then date. Correct preposition for date is on. Surgery is planned on 12th December. For month, it's in. For year, it's again in. For morning, it's again in. So next or in. So month is in. The health campaign will begin in January. For year, the vaccine was introduced in 2021. For morning, we use normally in the morning. In for general time of daily life morning. The doctor will check the patient in the morning. Then evening. For evening and night, we can use two prepositions like for different occasions. Of in when we are using for general time in the evening. Remember, the consultation will be in the evening. If we are talking about a specific evening, the conference is on Monday evening, not in the Monday evening. When we are generally writing it in the evening, when a specific evening, like on Monday evening. Here a specific is on. Then night. Normally for night we use at. The nurse checked on the patient at night. When we are talking about night in broader term, right? The symptoms worsen in the night. So when broader reference, then we use in. Otherwise, the appropriate preposition for night is at. Last one, there are few confusing words, like they are similar, so they normally used incorrectly. So let's go through them. First word is its versus it is. So its, its, is the possessive form of it. Like we use he, then possessive form is his, she, her. Similarly, it is its. There's no apostrophe, its. So this is the possessive form of it. So let's see. The hospital improved its infection control protocol. So its infection control protocol, it's the possessive form. Okay, this is different. And it's with apostrophe s. This is the contracted form of it is. It is, instead of it is, we write its. Okay, this is informal and incorrect. We shouldn't use this form, but we need to differentiate them. So let's see an example. It's essential to monitor the patient's vital signs closely. So right way is to it is meant essential. This contracted form is fully informal and it's different from this one. It's they are different. Okay. Then ensure versus reassure. Ensure is to make certain or guarantee, and reassure is to comfort or calm someone like normally patient. You will see in normally OET speaking this one, reassure the patient. So it means calm the patient, comfort the patient. So example of ensure that all surgical instruments are sterilized before the procedure. Like make certain. Reassure means to calm down someone, to comfort someone. So the doctor reassured the patient that procedure would be painless. Third, the difference between rise, raise, and elevate. Rise is to go up or increase without an external force. Okay. Rise without any external force. Raise requires an object. You will see a reason of something is raising. Okay, reason will be given. And elevate is an observational state again. It's just an observation. So let's see examples to make it more clearer. So first one, rise. The patient's temperature has started to rise. So they haven't given any like stressor or any cause, just it started to rise. Raise, on the other hand, her blood pressure was raised due to stress. Stress is the cause here, external force or object. So when there is an external force or external object is given, then it's raise. We will use raise. Her blood pressure was raised due to stress. Then elevate. Elevate is actually an observational statement. His blood pressure was elevated to 150 or 90. His white cell count was elevated to or at 14,000. So when we are writing an observational statement, we need to show increase of something. So elevate or elevated is the best word. So next confusing word, actually words, advice and advise. So advise, the one with C, is actually a noun, and advise with S is a verb. Actually they have similar meaning, but they are different from, like noun is used differently. Like, for example, for noun, for advice, the doctor gave the patient advice on managing diabetes. Gave is a verb, so after gave we'll use the noun form advice, not advise. If we need to use advise, so it will be used as a verb like this: he was advised to seize over the counter product. So this is the right way to use advise, the one with S. So next commonly confused words are to and up to. To indicates direction, purpose, or limit. So and up to the maximum amount or extent. So he was advised to seize over the counter product. This is not best example here actually. So best example for this one, it would be I am writing to wrapper. So this is showing a direction, but up to is specifically used for a specific limit. You can administer up to 500 milligram of this medication daily. Up to 500 milligram of this medication daily, up to which per limit or extent. Sixth one is the difference between through, via, and by. Through suggests movement within or across something. So diagnosis was confirmed through an endoscopy. Okay, but we can write the diagnosis was confirmed via an endoscopy, but via normally shows the route. Okay, so via is incorrect here, inappropriate actually. So the diagnosis was confirmed through an endoscopy. So this is use of through. Via is on the other hand used for specific route or method. For example, the catheter was inserted via the femoral artery. Then by. By indicates mean, agent or method. Cellulitis is most commonly caused by Staph aureus.